become to understand how important it is to work with patient advocates on projects that concern medical cannabis. And one of the people, you know, that works on policy, who's always been willing to have an ear towards patients and really come forward and help us get some concrete solutions, is Bruce Mirken. He's one of the easiest people I've worked with on the policy edge, and he's from Marijuana Policy Project. Please give a warm welcome to Mirken.
Thank you. And it's good to be here, you know, in front of this hospital where researchers just yesterday published an important new study in the journal Neurology showing yet again what we all understand, which is that medical marijuana is a safe and effective medicine. The Marijuana Policy Project works all across the country. And as you probably know, there are 11 state medical marijuana laws that have some form of ID card or registry. If this price increase goes into effect, California's will be the most expensive. So expensive that even the discounted rate that will be offered to people on Medi-Cal is 3 times what anybody in Alaska or Hawaii has to pay today. And the people who will be hurt most are the people who are the sickest, who are the most disabled, who are trying to get by on a limited income, who aren't going to be able to afford this card and the protection it can potentially give them. So this is a real problem, and it is a problem that the legislature and the governor can fix real easily. You know, the requirement that this thing be self-financing by a certain date was put in arbitrarily based on a guess as to how quickly the program would get up and running. It's taken longer than anybody thought. There is no reason that patients should have to bear the burden of that. But I do, as we think about what to do about this, we do need to be careful that here in San Francisco, we don't accidentally take an action that may help us here but will hurt people around the state. You know, we're lucky here. We live in kind of a bubble. You know, we have a city government that's not perfect, but is really supportive, that established a city ID card program before a state program was even thought of. And we could go to them and say, well, just set up the city card program again, make it cheap, we'll be taken care of here. But if San Francisco effectively bails out of the state program, we could really cut the legs out from under it and leave a lot of people in places that aren't so friendly, in places like Amador County and Riverside.